Ever wonder what it was like to get sick in the Middle Ages? Forget sanitized clinics and high-tech scanners. We're diving into a world where medicine was a strange and often terrifying mix of observation, faith, and sheer guesswork. The doctors, often monks or clerics, looked serious for a reason. Their tools were crude, their knowledge was limited, and the line between healing and harming was incredibly thin. The anatomical drawings of the time, while revolutionary, show just how much they were still figuring out about the human body. So, how did a medieval doctor figure out what was wrong with you? One of their primary tools was a flask of your urine. They'd hold it up to the light, examining its color, consistency, and even its smell. Using a special urine wheel, a chart with up to 20 different shades, they would diagnose everything from lovesickness to the plague. But that was just the beginning. The stars also played a huge role. Physicians would consult complex astrological charts to determine the best time to treat a patient. A procedure performed under the wrong celestial alignment was believed to be doomed from the start. Now, let's talk about the cure-all of the era, bloodletting. The prevailing theory was that the body contained four humors: blood, phlegm, black bile, and yellow bile. Sickness was seen as an imbalance of these fluids, and the most common culprit was an excess of blood. So the solution was simple: get some of that blood out. This could be done in a few ways. Leeches were a popular choice. These little creatures would be placed on the skin and left to do their work. For a more direct approach, a doctor might use a lancet to open a vein, or a device called a scarificator, a spring-loaded box of blades that made several small cuts at once. It was a messy, painful process, but it was considered the height of medical sophistication. If you needed surgery, you'd better hope for the best. Anesthesia, as we know, it didn't exist. Patients were often just held down or given alcohol to dull the senses. Procedures were brutal and fast. Instead of stitches, surgeons used a red-hot cautery iron to sear wounds shut, stopping bleeding but causing immense pain and scarring. And for head injuries or even severe headaches, the answer might be trepanning. This involved drilling a hole directly into the patient's skull to release pressure or, as some believed, evil spirits. The fact that anyone survived these procedures is a testament to the resilience of the human body. It was a high-stakes gamble, with infection being an almost constant threat in a world without germ theory. Looking back, it's easy to dismiss medieval medicine as barbaric, and in many ways, it was. But it's also important to remember that these practices weren't born from cruelty, but from a desperate desire to heal in the face of the unknown. The detailed medical texts they left behind, filled with observations and theories, were the seeds from which modern medicine would eventually grow. Their failures and their flawed understanding paved the way for the breakthroughs that save lives today. It's a humbling reminder of how far we've come. Thanks for watching. If you're fascinated by the history of medicine, make sure to like this video and subscribe for more deep dives into the past.